Assalamu alaikum wa rahmatullahi wa barakatuh. Greetings, everyone. I'm Robin Najm from Imam Rahman bin Faisal University. We welcome all in the first IAU virtual residency program, where we'll be discussing today cardiac surgery program with our speakers from different centers. Before we start, the Residency Programs Fair is an event that will allow medical students and graduates the opportunity to learn more about different residency programs around the Kingdom of Saudi Arabia. This year, the fair will cover 18 specialties from 34 centers across the kingdom. You will get the chance to hear from the residents themselves and ask them questions about their training centers, the lifestyle, and specialty itself. We hope it helps you find the right program for you, or at least assist you in making this important career decision. So now we will start first with the cardiac surgery program in Riyadh, and we welcome Dr. Murtada Al-Awami.
Hello everyone. Good morning. I'm Dr. Al-Awami. I'm a sixth-year cardiac surgery resident from Prince Sultan Cardiac Center in Riyadh. Thank you for inviting me for talking about my center in this gathering, and I hope I can be very benefit. So should I start in my slide now?
دكتور مرتضى.
ألو تسمعني؟
ألو هلا.
صوتك مو واضح.
صوت مو واضح؟
اي نعم.
الآن أفضل؟
تمام.
طيب ما أدري did you hear me before or؟
لا والله الصراحة ما حد سمع، ما أتوقع حد سمع شيء.
طيب. I'm Dr. Murtada Al-Awami. I'm a sixth-year cardiac surgery resident from Prince Sultan Cardiac Center in Riyadh. Thank you for inviting me to talk about my center in your gathering, and I hope I can be of great benefit for you all. Do you want me to share my screen now?
Yes.
Okay. Do you see my screen?
Yes, it's clear.
Okay. Okay, so I'm going to be talking about Prince Sultan Cardiac Center as one of the accredited centers for training in cardiac surgery in Saudi Cardiac Surgery Board. Okay, so I thought I'll start with this question. What are the qualities of a cardiac center that a cardiac surgery resident needs? So if you're thinking about joining a center, try to think of a center with a good reputation for training, with a history of training excellent cardiac surgeons, a center with high volume of surgeries, so you'll have an adequate exposure, and try to look for a center which is known to have a supportive environment for its residents. And the most important of all is a chance for hands-on practice, because at the end, hello?
في قطعة فوق نزلوها واللي قاموا شالوه نفسه غروه.
Dr. Murtada, you can complete. دكتور مرتضى إذا تقدر تفتح المايك لأن صوتك مو واضح.
تسمعوني؟
أيوة الحين واضح.
سمعتوا السلايدات الأولى ولا لا؟
بدايتها بس في الأخير انقطع الصوت.
Yeah, till the fair hands of chances. We reach the...
طيب now you hear me very well.
Yes, go.
طيب so what makes Prince Sultan Cardiac Center in Riyadh is an attractive training center for cardiac surgery. First of all, it was one of the first centers in the region that started cardiac surgery services. And it has a long history of training cardiac surgeons and other cardiac staff as well, like cardiac anesthesia, perfusionists, and they have a proper volume for of daily surgeries for fair exposure for trainees, and they have a balanced variety of cardiac surgical procedure. For example, if you compare it with the other centers, some centers they have more CABGs or coronary artery bypass surgeries in relation to other surgeries like valve surgeries. But in Prince Sultan Cardiac Center, I think they have a good balance in terms of type of surgeries. Like 50-60% of the surgeries are coronaries, and like 30-40% are valve surgeries, and they do both the conventional valve surgeries and the minimally invasive surgeries, as well as good exposure to heart failure surgical therapies like transplant and ECMOs and things like this. So this is the most important things that could make you think about Prince Sultan Cardiac Center. It's a four-floor building with 5 theaters, 2 theaters for adult cardiac surgery and 2 theaters for pediatric cardiac surgery, as well as 1 hybrid room, which practice both interventional cardiology and cardiac surgery. And all rooms almost busy daily. So we'll have like 5 to sometimes 6-7 per day, because some of us work 1 or 2 procedures per day. There is a big surgical ICU with more than 30 beds for both adult and pediatrics, and inpatient capacity with more than 50 beds. And the total bed capacity for the whole center is more than 170 beds. Why this is important for you? Because when you think about joining a center, you need to make sure that they do actual surgeries. So you have to know that in cardiac surgery, it's a referral service from cardiology. So you have to have a good cardiology service in order to have a good flow of patient for cardiac surgery. So because most of our patient comes from the cath lab and from the other services in cardiology. So the more patients, cardiology patient you have, the more cardiac surgery patients you will have in the center. Those questions were handed to me by Dr. Duha. So the frequency of on-calls per month in our center, it depends. It depends on many factors, like how many residents per rotation, how many hospital staff we have at that month. But usually it's around 4 to 5 per month, something like this. And you know that the Saudi Commission require 4 to 7 on-calls per month. So we are falling in between the range that is required from the Saudi Commission. How busy are the on-calls and what cases do you typically see? This question is actually, I cannot answer it because sometimes you'll be busy since you start the on-call until next day, and sometimes you have nothing to do. So, but in general, it's not that busy because you have people covering the ICU and you have people covering cardiology patient. So you as a cardiac surgery resident, you will only cover the issues regarding your post-operative patient, and if there is a need to go back to the OR, usually there is a more senior surgeon with you. You can call and to help you on serious matters. Yes, what are things you typically see? You see things related to post-operative patient care usually. How many rotations are taking outside the center? Recently, only this year, the center now is accepted as an independent training center. Independent training center means that all the rotations can be taken inside the centers. So if you join PSCC, you will only go out for rotations that is not available in our military medical city. And currently only the trauma surgery, as far as I know, is not available. So except for 3 months in trauma surgery, you will spend the whole training inside the center. You have, I think, 1 month elective in your junior years, or 2, I'm not sure. And you have a 6-month elective on your senior years, where you can take outside rotation after organizing with your program director. How is the performance usually assessed? In cardiac surgery and in most surgical specialties, you will be assessed by your seniors who is working with you in the operating room. They will assess you and they will give you feedbacks, and you have also to ask about feedbacks in order to have a good idea about your performance. This is regarding surgical skills. Of course, the academic performance is assessed by the exams and the evaluation that you submit to the Saudi Commission. Does the center provide its residents and fellows with opportunities to complete their training abroad? Yes. When you will join as a trainee. So you will sign a trainee contract. This trainee contract, when it ends, they have the choice of recruiting you or not. So if you are recruited to the center, then you can apply for a scholarship. And now we have 3. Yes, we have 3 or 4 graduates already, and all of them were secured with scholarships. What else? What does the program offer in terms of residence education, academic activity, courses, workshops, simulation, research opportunities, and hands-on exposure? So our residents are released every Thursday afternoon to join a weekly academic activity with all other board trainees. And throughout the year, there are different courses and workshops and conferences that is announced in every 1 or 2 months. And except for this pandemic time, there is a little to offer in this time. But normally usually there is a lot of courses and workshops and review courses. And for research, actually research is self-effort. You have to do it yourself if you are interested. You have the patient, you have the data, you have a research center, You have interested consultants if you want to work with them on research. Um, and hands-on exposure is satisfactory. How many positions per year are opened in the center? Usually they open 2 positions every other year. Last year they accepted 2 residents. That's it for my presentation, and thank you.
Thank you, Dr. Murtada. And now we welcome Dr. Ayat Ibrahim from King Faisal Specialist Hospital and Research Center.
Okay, good morning, everyone, and thank you for inviting me to this webinar. I think it will be beneficial for all of you guys. Also, we can benefit from you. So let me share my screen. Can you stop sharing so I can do so?
دكتور مرتضى إذا تقدر.
Okay, now it's okay. You can see my screen?
Yes.
Okay, so I will start with an introduction about myself, and then I'm gonna talk about the questions that you handled to me, guys, regarding what you need. So about me, my name is Ayat Hussein Ibrahim. I'm a 3rd year resident. I belong to King Faisal Specialized Hospital and Research Center in Riyadh. And I started my journey like when I was a 3rd year medical student. So I attended ORs, I've seen patients myself with the supervision, and also I've been involved with the patient's management under supervision, of course. So it was a long time ago. I had passion toward cardiac surgery before joining medical school even, and that was my ambition. And the heart itself, it actually attracts me with the congenital anomalies I love to read about. So this is how I started. About the program, the cardiac surgery program, so my opinion, it's improving. So things are getting better and more clear since I started the residency. I think it's now more well established and also organized, and people are getting more familiar with having residents that needs training. Of course, there are difficulties, guys. So you will face difficulties, but it deserves. Of course, you know that things in OR are critical. You have nobody will let you touch the patient unless you read about the surgery that you are going to attend. At least you have done it before once, at least you have seen it. So exposure is important, as Dr. Murtada mentioned. So work on yourself, on your skills, read daily, at least a piece of information. Anything you hear from anyone, just go and search about it. Take benefit from each rotation you join, consider yourself as their residents, and get out of the box. So if you are in a general surgery rotation, then you are, consider yourself at least in this rotation that you are a general surgery resident, so you can take benefit and think like them. So we are, as residents, being evaluated based on many things that Dr. Murtada mentioned already. So knowledge, you have been evaluated about that in your promotion and part exams. Promotion that will promote you from a year to another, and the part will promote you to be a senior. The academic activities also, the weekly academic activity, you have to attend and participate. Also the evaluations of the rotations that you join, and also your logbook. So this is a brief about the program. And now I'm gonna talk about the center that I belong to. So our center usually accepts 2 residents per year. It actually, it's one of my best decisions that I joined King Faisal Specialized Hospital and Research Center. What I like about it is the environment and the system. It's well organized, and how people communicate with each other and how they deal with the patients. And guys, I might be biased to my center, but really I can see the improvement every day in this organization. I can see also the hard work. So of course there are difficulties and weaknesses, if you like this word more, but can be solved. I think it's the matter of time, and we always meet in the organization to discuss how we improve ourselves and how we improve things in the center. The hands-on needs to improve. So I think it depends on multiple aspects. So it depends on the team you join, it depends on the consultant, how they think. It depends on the surgery itself, if it is complicated or not. It depends on your level. But overall, it depends on something that I mentioned earlier. You have to read, you have to be exposed more and more to surgeries, you have to improve your skills so you can get the chance, and always be initiative. It's related also to the program itself. So we have to have a planned residency. We have to have a for each level, we have to have skills that can be done. But I think it's really improving. It's really improving since we started the residency program. So in our center, we have a great number of different types of surgeries per week. So we have 7 to 10 for adults. We have 10 to 12 for pediatrics, including minimal invasive robotic surgeries. We have also transplant, and we have the opportunity to work with excellent senior surgeons. On the other hand, we have also wet and dry labs. We have animals that simulates the things happen in OR. So we are exposed to complications, and we know how to manage them in the animal lab. We have also in our center a daily activity. It's on 6 a.m. We meet with our program director, Dr. Hogir. We discuss multiple topics, and we manage it ourselves. So we put the schedule, we tell Dr. Hogir, we join together at 6 a.m. and we discuss. We have also our weekly grand round on 7:30 on Thursday. And you have the opportunity to meet lots of people with different thoughts. So of course you are gonna get benefit from that. Regarding courses and workshops, they are available, but as Dr. Murtada mentioned, that we have restrictions now with this pandemic, but it opened, it opened the door for online courses. So it's becoming now more. So you can get any online course you want. About the on-calls, so we have average of 5 to 8 calls per month, depends on our numbers also. It's not that much busy. You can manage it actually. You admit patients, you prepare them for OR, you address patients' complaints and wards, and you take a decision. Also, they might call you for an ICU patient that usually has a team for that. Yani. You will not cover it. Sometimes you see discharged patients also coming again for with symptoms. You have a new consultation, for example, that sometimes referred to you by a mistake. It's a cardiology patient, so you have to take a decision and you have to take a full history and examine the patient so you can avoid, not to misdiagnose the patients and avoid mistakes. So you might have a chance also to attend OR, you work with them, for example, for post-op patients being explored or ECMO being inserted. Always be initiative, as I said, so you can get the chance. Nobody's gonna grab you from your hand and tell you, please attend. No, you have to be initiative. You have to ask, okay? About the research, yes, I think it's a great opportunity in our center. We have a research center. It's being supported all the time, so you can do your researches. Training abroad, yes, my center supports that. And as Dr. Murtada mentioned, that being independent now is the trend. So our center is still supporting the outside rotations, but in the future, as I heard, that the center will be completely independent. except for some rotations that you cannot take them in the center itself. So like a trauma rotation, our center is not a trauma center. So you have to go to a center where a trauma is more, like National Guard or Shumaisi, for example. At the end, I wanna say that, do I like my new life at King Faisal Specialized Hospital Research Center? Yes, and I recommend going to my center. I told you I might be biased, guys. And thank you.
Thank you, Dr. Ayat. Now we are going to move to cardiac surgery program in Jeddah, and we welcome Dr. Abdul.
Hello?
Yes, doctor. You can start.
Can you guys hear me?
Yes, we can hear you.
Okay, my connection is internet connection is very weak because I'm in the hospital. I'm not sure if because your voice is interrupting. Dr. Duha, can you hear my voice?
Yes, it's clear.
All right. So I'll start. First of all, my name is Abdul. I'm cardiac surgery resident at King Faisal Specialist Hospital in Jeddah. I'm R6 currently. I do apologize because we do have an emergency case and I'm at the hospital right now. I did not bring my laptop. So I'll just go over the points that Dr. Duha gave us previously. So I'll just go through them and I'll do my best. So why did I choose this center, King Faisal Specialist Hospital, Jeddah? Basically for me, because I live in Jeddah, so I had to choose the best cardiac center that is close to my home. And one of the things that made me choose this center is because it's the most prestigious cardiac center, meaning that one of the advantages when you choose a cardiac center, that you need a center that is well equipped with all facilities that the ancillary services that comes with cardiac surgery to make sure this is a very good program that you can join, and you want to go through all the training years with the referring tertiary center that does many cases of cardiac surgery. So that's why I chose the center, to be honest. I'll try to be as transparent as possible because my goal is to get to convey my first-hand experience to the newcomers or the new interns who want to join this program. So what are the center's strengths and weaknesses? To be honest, I'll only talk about the positive things because I haven't. So this hospital is King Faisal Specialist Hospital Jeddah branch is I wouldn't say I would say it's less smaller than most of the cardiac centers in Riyadh for sure. We have basically 2 operating rooms that are assigned to cardiac surgery. We have 1 hybrid room that is assigned for cardiology and cardiac surgery cases. And we have almost 15 beds, including adult and pediatric cardiac surgery in ICU. Talking about cardiac surgery ICU beds, we have a capacity of 15 beds, plus 3 beds CCU that are assigned for also as a step down from cardiac surgery ICU. So you can see how smaller in comparison to most of centers in Riyadh. But it's one of the busiest center in Jeddah and the western region that does provide cardiac services. So this is one of the limitations, as Dr. Murtada mentioned. If you're joining one center, you want to make sure that they do a lot of cases. And one of these criteria that they have a good ICU bed capacity, so you don't have any cancellation of cases because of lack of ICU beds. So that's one of the main limitation. For example, we have a lot of booking, and then we also have a lot of cancellation because of sometimes no available ICU beds if the case permits. The next point is my experience with this program. I'll talk about the experience at the end of the talk. So the average number, the next point is the average number of surgeries per week. So we do operate every day of the week. We operate from Sunday to Thursday, adult and pediatric cases. It's scattered. We have a total of 5 full-fledged consultant cardiac surgeons, 3 adults, and 2 pediatrics. One of the senior consultants does adult and pediatric cardiac surgery plus thoracic surgery. So we also do thoracic surgeries within the service. So it's adult and congenital and thoracic surgery. Every day we have an average of 3 cases minimum. Sometimes we do 4 or 5 cases if the ICU beds permits and available. So mainly limited by the ICU beds. But in average, we do have 3 cases almost on daily basis, including adult and pediatric. And we do have hybrid procedures almost every day, around 1 case. No, I would say 2 cases a week, including TAVI or TAVR procedures. And the next point is frequency of on-call per month. Frequency for us residents, we do have 8 calls per month. So basically 2 every week. You have 2 calls every week, and our call basically is a 24-hour coverage. Because of lack of residents in our center, this is one of the advantage and disadvantage at the same time. An advantage that you get exposed, you get a good exposure to everything in cardiac service. So you have a good training, and it gives you good training in terms of responsibility or responsible for everything. And every patient in the floor, you are the first contact all the time. And it's a large number of calls. If I would say, how busy is the on-call? My experience is very busy on-call because we don't have adult ICU coverage. So basically, the on-call the one who is on-call is covering the adult cardiac surgery ICU. So for example, I give you a day of on-call breakdown. We come at 7 or before 7. For me, I come before 7. I try to come before 7 and see, take a glimpse, a quick overlook on the ICU patients, see who is critical, who is not, who am I going to be stuck with the entire day, and then go over the inpatients. And then before 7:30, I'll take the quick endorsement from the previous on-call. So once it's almost 7:30, the round in ICU starts, and then inpatient rounds will also start quickly. And then all surgeons will go to their OR. Whoever is assigned to OR will go to OR, but the ICU would cover the on-call would cover the ICU patients. And then from 9 to 12, I would say, we have a morning clinic, which is a very small clinic, around average of 4 patients a day. We see in between this time, we go down to the clinic whenever the patient is there, and then back to ICU. And then at around 12 or 1, if the first case finishes, will go and receive the first case from OR team and manage the patient. After that, I'll start doing rounds with every consultant for inpatient and also their ICU patients. After that, final the last cases would finish at around 4 to 5. So after that, it will become less busy. I only deal with post-op cases. Try to get them through the night until tomorrow to get them hemodynamically stable. And if there's anything, always, of course, there's a senior surgeon with you who is backing you up, but mainly the residents are covering the ICU. So that's a glimpse. And then, of course, that's a glimpse of the on-calls and how busy it is. So this is an advantage and disadvantage because you get all the load, but at the same time, it's very rewarding because you get to learn how to manage critical cases. The next point after this is how many rotations are taken outside the center. I think the doctors previously, they spoke about the Saudi Commission and their how they distribute the rotations. Basically, you're allowed to go. There's no specific regulation on how many months and how many blocks you want to do outside the center. It's just it's a communication between you and your RTB. If you see the need of going outside to see another specific cases in other centers that are not being done in the center, then you have a justification and nobody would stand in your way. At the contrary, everyone is very helpful and down to earth. They are very supportive. Everyone here is very supportive, and the environment is very family-like support. Okay, how is the performance usually assessed? The academic performance is usually we do have with Dr. Farid Khogair has been on top of this training program. It's been optimized now. We have one platform that we do our academic activity. But Dr. Loy Al-Khalafi is the one who is organizing and the rest of the group, and Dr. Murtada also as well. They are arranging for the academic activities, but in terms of internally inside the hospital, there's no specific form of regular assessment other than just the usual. If in terms of surgical skills, I would say there's an assessment. Usually it's a graduated like skills. So basically when we start usually going into the cardiac OR from R4 to R5, R6, and then R7. From R4, when you first come, they need to get to know you. They need to know how what is your basic skills, how well are you at this level. So we'll start with incisions, and then you start to harvest the veins first with assistance. And then as time passes by, the first month, if you are comfortable, then you'll do your first vein harvest. If you're comfortable, then they leave you alone to harvest the veins and prepare the veins and all that. And then after that, after you have done multiple cases, you're doing very well with this, you no longer need to go and do it again. You'll take the next step and start doing sternotomies and so forth. So it's a graduated like program, and it depends on your RTP. You need to stick with one RTP, so he would know how your progression and everything. The next point is, does the center provide resident fellows with opportunities to complete their training abroad? Of course, we have a scholarship program that supports everyone who financially, that provides you with a financial letter to everyone who wants to seek training abroad with a residency or fellowship. We have many graduates and also residents who actually were in our program, but they got accepted elsewhere. They did not get furious or anything. On the contrary, They were very supportive. They sent them with a financial letter. So they are very supportive. We have a very good scholarship program, I think, in King Faisal, Riyadh also as well. The next point, what does the program offers in terms of residence education, academic activity, courses, workshop? All right, we do. It's a training program. It's a training center with research facility. So we do have many courses along the academic year. Internally, we do have cardiology training program as well, and workshops throughout the year. And also we have Ecmo training program. So all the trainees inside the hospital are supported and paid for. So don't need to pay any admission fees or anything like that. There's an Ecmo course. There's an for juniors. There's ECG courses, and also for any national or international conferences. Also, there you guys are supported if you are sponsored by the facility. So they pay for your tickets and everything if you apply for it in advance. And we do have a good library and all the resources you need. It's available. For the last question, how many rotations per year? How many positions per year are opened in the center? Last year, I would say we did not accept anyone. I don't know why, but I think the pattern in our hospital, they accept every other year. So the year before, I think they accepted 2, and then or accepted 1, unfortunately, and then the next year they don't accept 1. Maybe this year they will accept 1. So I think this is the distribution. Yeah. So my experience, the last question, my experience overall is a very positive experience. I'm very glad that I joined this program in this hospital. I think it's one of the busiest programs, and most importantly, when you join a program, you make sure that you get along with all the surgeons. You make sure you get along with all surgeons, and you get a good personal rapport with them, because eventually, if they trust you enough, they'll let you do whatever you want. If you prove to be a very good trainee and you are punctual, I mean, you're excellent in every, you're on top of everything. You're showing how hardworking you are, and you're attending to every details, and you're not slacking down or doing anything that reflects negligence from your side, then they will trust you. And once you build this level of trust, then the sky is the limit. You can do whatever you want once they trust you. So that's my advice. Thank you very much.
Thank you so much, Dr. Abdul Badi'. And just I want to say that at the end, inshallah, we will receive all the questions from the participant. And now we are going to welcome Dr. Rahman Raheli from Saud Al Batin Cardiac Center from Dammam.
Assalamu alaikum. So thanks to my colleagues, I think they talked about most of the questions. A good resident. So I'll talk about my experience in Saud Al Batin Center, and later. So guys, I didn't make there is it. So I'll go through the questions was sent to me with the strength and weakness of the center. So within 1 year, a lot of things have been changed very fast. I mean, 1 year ago, there was no 2 consultants was joined the center. هم دكتور عبد الله العتيبي ودكتور فوق. تغيرت مرة كثير. Nowadays, Dr. Abdul Atibi, he's the program director and willing to change a lot of things during the last 20 years. So I'll go through the strength points of the Saudi Batin as we know, the Eastern.
Dr. Abdulrahman, can you hear me?
Hello?
Yes, Dr. Abdulrahman.
Yes.
Voice is not clear. If you can just make it more clear.
الآن واضح الصوت؟
Yes.
اوكي. فما ادري اذا سمعتوا الكلام اللي قبل ولا عيد منه.
لا, it was fine
اوكي. So مثل ما تكلمت اللي هو السترينث points of the Saudi Batin we're having as I said, it's the only governmental center in the eastern region, so we're having a good number of cases every week. So the number of cases, it's between 8 to 10 cases per week. 2 theater. So the 2 theater is working daily for the residents. For me, I've been working with Dr. Abdul Atibi, where he's one of the young generation of the young surgeons. So I don't know, maybe my colleagues agree with me or disagree. For me, I like to work with the young generation of surgeons where they are more flexible and more willing to teach. Yeah, so for Saudi Batin, there's 2 teams of the cardiac surgery where 2 residents, Dr. Abdullah Shabi and me, each resident with each team. Yeah, we're dealing with a good number of cases, 8 to 10 per week for each team. So 8 to 10 for each team. One of the good points of the Saudi Batin, you will have to see a good number of off-pump cases, the cabbages of pump cases, where Dr. Farouk is most of his cases working in off-pump cases. فراح تشوفون اللي هو الاوف بامب كيسز اكثر شيء مع الكارديولوجي والانترفنشن كارديولوجي where we have to see a good discussion of the cases. One of the so I'll start going through weakness points. في البدايات سابقا there was no activity for the center. Nowadays we're trying to fix the weakness point. حاليا we're having a weekly activity for our residents. نبدأها في الخميس الساعة 9:30 وننتهي على الساعة 12. So we can join the committee اللي هو activity حقت الهيئة. We're having a journal club like every 2 weeks. One of the residents had to present and to discuss the journal club with the consultants. Research meeting, حاليا في a research meeting every 2 weeks. لأن الprogram director Dr. Abdul Atibi, he's encouraging for the residents to have their own research every year. So yeah, there is a research meeting for 2 weeks with Dr. Abdullah and Dr. Mohammed Qudeh, the head of research committee. We're having a case presentation every week where one of the residents is presenting a case we have working on in the center from A to Z, and to have also an article discussing that case and how give us the update about the case and how to deal with it. So حاليا هذه اللي هي النقاط strength and weakness of the center. My own experience with the program، أنا ما أدري يعني أعتبر من القدامى في البروجرام اللي قبل اللي هو you have to rotate outside the program for 3 years. I think things have been changed for the new residents. لأنه سابقا كنا R1, 2, 3, you have to rotate outside of your specialty to go through general surgery, thoracic surgery, vascular surgery, pediatric surgery, ICU for the whole 3 years. فما يكون عندك أي علاقة في الكارديك surgery. I think things have been changed حاليا. You'll be joining the cardiac surgery from R1, I think, for 3 or 4 months, and R2 and 3. So you'll be joining the cardiac surgery for the first 3 years as well. Yeah, I'm not gonna talk about the old method of the program. The average of surgeries per week, yeah, I've talked about it. Like we're having 8 to 10 for each team weekly. It's a variety of cabbages and valves, mainly the aortic and mitral valve. Cabbages, you got to see off pump. If you're working with Dr. Farouk Al-Uwaila, is one of the senior consultants of the center. You'll see a lot of off pump cases. Frequency of on-calls per month, each resident, Dr. Abdul Shihri and me, we're having 6 to 7 on-calls per month. How busy are the on-calls, and what cases do you typically see? I think we both, Dr. Murtada and my colleagues, we talked about the on-calls. It's not that busy, the on-calls, unless if you're covering the ICU. Sometimes you're covering the ICU, so it's gonna be busy, especially if you're having a case was done at the day of your on-call. لكن عادة you're not covering the ICU, so it's not that busy. إلا في حالات إذا if you had an emergency surgery or aortic dissection surgery, so that's gonna be a busy day. How many rotations are taken outside the center? As we know that Saud al-Batin is a cardiac center, so you have to rotate the cardiology and cardiac surgery on the center. Otherwise, you have to go outside for the general surgery, thoracic, vascular, ICU, if you're willing to take a general ICU, not a cardiac surgery ICU. The performance usually, how is the performance usually assessed? I think Dr. Murtada, he talked about it by the evaluations, and Dr. Abdul Tabi here, the program director, he's starting a new thing where he's sometimes given the resident with him an oral exam, like during the round or during the surgery while you're standing on the patient, giving you an oral exam where he depends on during the evaluation. Does the center provide the resident and the fellow the opportunity to complete their training aboard? Well, this question, I don't know. I don't know how to answer it. Till now, there is no resident graduated from this center. We have only one graduate, Dr. Rahman Ibrahim, where he's joining the King Faisal University now. Like president for the center, I don't know if they are gonna provide or not.
Dr. Abdul Rahman, if you allow me.
Yes.
Yeah, because I was also interested to join Saudi Babtain before. So I talked with Dr. Khalid Iskandar about this, and he was very excited and supportive for the idea of sending his residents abroad. So I think the Shadbab 10 is supportive for completing your training outside.
Yeah, I think so. And, I think, yeah, I've heard Dr. Khalid Kader, he was talking about the opportunities and scholarship after the program. So yeah, I think so. So yeah, so what does the program offer in terms of the resident education? As I said, we're having a weekly activity every Thursday from 9:30 to 12:30, where we one of the residents is assigned to talk about a subject where, and one of the consultants will join us, guide us, and illuminate us about the subject, like talking about his experience or update us about the subject. So most of the time, Dr. Abdul is joining us, Dr. Fahd al-Makhdoom, Dr. Hamd al-Qadih, and Dr. Farouk al-Weda. So yeah, we're having a journal club every 2 weeks with the fellows from the cardiology department. So every other week, one of the cardiac surgery resident or the cardiology fellow had to present an article or and talked about it and discussion about it. A case presentation. This is a new thing. What was started 2 weeks ago with the Dr. Abdullah Tabi, where one of the residents had to go through a case was done on the center from A to Z, like starting from the history, presentation, surgery itself, ICU course, then the ward course, and then he had to approach an article about the case related to the case and talk about it, and then we'll start to discuss about it. I've mentioned before, I don't know, I like more to work with the young generation of surgeons, where are they more flexible and willing to teach and talk. I don't know if my colleagues agree with me or not. Like yeah, for me, I like to work with the young generation. Research opportunities. The center, the head of research committee, Dr. Mohammed Al-Qadih and Dr. Abdullah Tabi, they are willing and encouraging the residents to have their own project every year. Like you have to finish their project for every year. This is, I don't know, Dr. Abdullah's vision that you have be graduated from the program and you have at least 3 to 4 projects assigned to your name. The last question, how many positions per year are opened in the center? The center is accepting 1 resident every other year. So this year, I think they had, I don't know if they will accept 1 resident or not. Last year they didn't. This year, I don't know, actually, maybe not, I'm not sure. So yeah, this is the questions, and it was handled to me, and inshallah, I covered most of it, and if any of you guys having any question to ask, I'm willing to answer. And thank you.
Thank you, Dr. Abdul Rahman. And now we welcome Dr. Mohammed from King Abdullah Medical City in Mecca.
Assalamu alaikum, everybody. Dr. Abdul Rahman, if you may, please just let me to share my screen.
I'm not sharing the screen. I think one of the coordinator is.
Oh, okay. Sorry. That's fine.
That's okay.
So, Dr. Adoha or Dr. Roba, anybody who can allow me?
Sorry, doctor, just a minute.
Okay.
رباب إذا ممكن you can stop the screen share. Okay.
Okay. So I'm Mohammed Babbi, a second year cardiac surgery resident from King Abdullah Medical City in Mecca. Usually I'll be speaking about the same point that you sent to all of us regarding the program at each center. I might have done a little bit of changing the arrangement of the question. So at the beginning, I'll start with the strengths and weaknesses of our centers. One of the most important strengths which I'm considered for my center is the Hajj and Umrah season, and it is the only cardiac center in Mecca. Mentioning these two points is reflecting how much the volume that we receive and the variety of cases and cardiac anomalies that we observe during these two seasons specifically, with a lot of people coming from different areas of the world. It is a great opportunity to see such a variety of cases, different cardiac anomalies that you have never seen, you only read about it. You have the opportunity to see it during these two seasons. In addition to that, at our center, we gladly started the heart failure program with the LVAD program recently, like 2-3 years ago. And we start progress in that matter, and hopefully, inshallah, we reach to develop a heart transplant program in the future. Not in the near future, but hopefully we'll reach that level. We do also do a good number of minimally invasive cardiac surgery or cardiac procedures. We don't do the full spectrum of minimally invasive procedure, meaning the robotic surgeries and so forth, but at least we do the mini thoracotomy valve replacement for the mitral and tricuspid. We do the mini sternotomy for aortic surgeries. We do have the TAVI surfaces, usually done by the cardiologist, intervention cardiologist, but the cardiac surgeon are starting to have a part in that as well. In addition to that, we are one of the Ecmo centers in the region. I think there is only one center in Jeddah, King Abdullah Complex, and we are the other center in the Western region. And we are covering a large landscape in the Western, in the Northwest and North and Southwest areas of the kingdom with the Ecmo services. And we have a very good research opportunities with a research-oriented surgeon who is supportive and encouraging for research production, in addition to the research center that we have with a good support and guidance with the research clinic and so forth. The weaknesses of our center, one of the most important weaknesses that I consider the biggest weakness of our center is that we are lacking the congenital cardiac surface. It's usually a political issue, a high organization not related to the center. You do have a lot of congenital cardiac surgery centers just near to us in Jeddah, through which we can rotate during our congenital surgery rotation in our program. Second important weakness is the number of consultants. For a long time, we had only 2 full-time consultants. But now the number is increasing, and it is considered a weakness a little bit because you are having less exposure to different techniques and different background of surgeons. Having multiple or more number of surgeons will give you a better ideas about different procedures, different techniques, and it will open up your mind. as I said, being the only center in Mecca, and especially we are having these two important seasons, we are having, I would say, a fair or a good volume of cases. We are not a big center like King Faisal Specialist Hospital or other Prince Sultan Military Hospital, but we are having like two cardiac surgery OR with one hybrid room. We are operating at least average 2 cases, sometimes 3. Very rarely we operate 4 cases, especially these times. Average weekly operation is of about 10 cases. We're reviewing the last 5 years with a number of procedures that have been done at our center. We are like increasing in terms of number of cases. It's obvious, clearly obvious. From 2016, we were doing like 477 procedure a year, up to 783 procedure in 2019. And if you can notice, even though we were in a COVID era during the year of 2020, although we have done about 510 procedures. And not necessarily all of these should be the first procedure or the original procedures. Some of it might be either re-exoperation or wound debridement, but it's representing only a minor percentage of the total number of procedures. I would say not more than 10%, if I'm not mistaken. So the frequency of on-calls per month, it is based on the regulations and the policy of the Saudi Commission, with about 6 to 8 or 5 to 8 on-calls per month. And due to the limited number of staff, meaning the assistant consultant and the smaller number of residents we have at our center, with only 2 residents rotating at the cardiac surgery service, sometimes the resident take the full number of on-call with 8 on-calls, and sometimes in the hectic time they might go for larger than that number, but less likely just in specific situations. Most of the time we are not exceeding the number of 8 on-calls. The nature of the on-calls and the cases that typically seen during the calls, as all my previous colleagues been mentioning, it is the same. Most of the time nowadays, the ICU is being covered by specialized ICU physician. So cardiac surgeon will not cover the ICU post-operative cases. So most of the time you will be dealing with the pre-operative cases in the ward and post-operative cases. And usually it's not that hectic night. It's a calm night almost most of the days. You will deal with a routine pre or post-op cases. Patients usually post-op arrhythmias, simple minor arrhythmias, post-op pain. The most common complaints of patient post-operative. Sometimes if you have a patient with critical anatomies or something in the ward who might convert to unstable situation and you need to follow him closely, you might shift him to ICU and do certain, but very rarely you have such a cases. We do have a lot of emergency cases, specifically trauma cases that comes to our ER from other hospitals in the region with a stab wound to the heart, and we do operate a fair number of cases with penetrating cardiac trauma. Dissection cases, we do a good number of cases of dissection patient. The rotation that's usually taken outside the center. Usually it is the rotation that you're lacking at your center, and the most important 2 rotations that we are lacking at our center is the congenital cardiac surgery rotation and the trauma surgery. Although we are the center that dealing with the cardiac trauma, but we are lacking other trauma services. So during your trauma surgery rotation, you have to have it in a different center. Congenital cardiac surgery rotation, of course, you have to go for other centers to have it. Other specialties that I wrote in here, it is not necessary from you to have it in a different center because it's available at our center, but it depends on your objectives that you set for yourself and the level of skills and knowledge that you want to have. Most of the time, cardiac surgery services are provided at the tertiary center. And at the tertiary center, you will not see the common general surgery issues, vascular and thoracic surgery problems. So we do prefer, at least at our center, the resident and program director, that you do take your rotations at the junior level for vascular and thoracic surgery at the busy centers, the general hospital. And then at the senior level, you may take it at the tertiary center. So you will get exposed to a different variety of minor and more complicated issues related to those specialties. And regarding the opportunity for the resident fellows to complete their training abroad. For resident, our center is not sending a resident for scholarship, but they do send fellows to do their post-training fellowship further sub-specialization. And it's variable each year, because previously they were like, once you have an acceptance, they will send you immediately. Nowadays, they are having more regulation, and I don't know, is it a matter of funds or something, but it's variable each year. And they open a number of subspecialty depending on the need of the centers. Sometimes they might have exceptions if you do have an acceptance for fellowship and you have an acceptance in a very subspecialized and highly acceptance, and they send you. For in training rotation, your resident, if you want to have like a short period rotation in one of the international centers, I think it's allowed by the Saudi Commission at a senior level with a period not more than 3 months. Dr. Murtada might have an experience, and he might correct me if I'm mistaken. The assessment method usually practiced at our centers. Assessment methods that's recommended by the Saudi Commission are variant, and there are plenty of methods for assessing the resident during their training. Most common method that being practiced at our center, the direct observed procedure skills, which is usually the everyday things that they do. They observe you during your time in the OR, your doing with the patient, and all of these things. And the feedback, of course, every day you will have a feedback, and you have to ask for it if you didn't have it. This way you will learn, and you will know your limitation, your mistake, and you will improve yourself. And of course, the ITER, which is a mandatory thing that's been done after each rotation by the Saudi Commission. Other methods of assessment like mini-CX and CBDs, all of these, you may just ask your consultant, and they are welcoming to do any of these for you to assess you. But sometimes it needs an effort and initiation from your side. A number of positions per year. Acceptance at our center is not consistent, meaning that they will not accept each year, and it's not like a fixed regulation or rule that every other year they will accept, or every 2 years they will accept. No, they are evaluating the situation based on the number of the resident and the volume and the number of consultants at the center. And based on that, they will decide whether they are going to open a position that year or not. So far, we are a total of 4 residents, with the most senior one at the 5th level and the most junior one at the 2nd level. The last year, we did not accept any resident, and most likely this year, they will not accept any resident. For the next year, it's not clear yet if they are going to accept or not, but it depends, as I said, on the number of consultants and the situation of the volume of cases, and just to not to compromise the ratio of the number of cases to the resident, and not to affect the exposure for the resident. What does the program offers? Usually, if I'm speaking the program regarding academic, I think this year we are having like a universal academic activity for the whole resident in the kingdom that's being conducted weekly on Thursday. The academic activity within the center, we don't have it as a regular activities, but we do have sporadic teaching activity. For example, if we have an interesting case, then one of the residents has to present it with some research of the literature about that situation, or if there is a very interesting new article that's being published, we might in a journal club, but this has not been done regularly, but it's being done every now and then. Research opportunity, there is plenty of research ideas and opportunity available, especially as I said during Hajj season. Research environment is excellent with, I would say, specifically our RTP, Dr. Nazir, he's a very oriented surgeon, a research-oriented surgeon, and he is research lovers. So you will get the chance to publish a lot of articles if you have the enthusiasm and the effort and the hard work to do so. So once you feel that you are interested and you will work on research, he will give you lots of ideas, and there are lots of ideas, and we are producing a good number of researches. Hands-on exposure. I would say it's variable among different surgeons. Not all surgeons at our center will give you the opportunity to have a fair or a good hands-on exposure. It needs some time from your side and from their side. I'm saying that because we are the youngest program in the kingdom. We are just 5 years old. They are not used to have a junior trainee to work with them, and they will have some time to build up the trust on us as a resident to give us the chance to do a more advanced or sophisticated skills, and until they see you're doing at the basic surgical things, and once they trust you, they will progress with you. So it depends on your pace. If they saw you're improving in a faster pace, you are fulfilling the competency with a good outcomes, then they will go with you to the next step. But it's needed hard work from your side. Unfortunately, we don't have seniors until last year, so most of the rotation were spent outside the center at services other than cardiac surgery. So just from last year, they start having a resident doing a full-time cardiac surgery service. With some of the senior residents came to us from Riyadh. I have seen those residents who came from Riyadh doing an advanced cardiac surgery skills alone, just with the supervision. So once you have the skills and you prove that you are having the excellence in doing that, and they trust you, they will give. Lastly, the reason why did I choose this center was my own experience. Even though I'm just an R2 resident, but I do think I have a bit of a humble experience before joining the residency with this center. So far, I'm happy with my choice of choosing this center. Reasons, as I mentioned, those factors at the beginning, the volume of cases is fair. The number of residents is not too much, so you will have the chance to have a good exposure, and you will get the chance to work in a larger number of cases. And the center is progressing and improving. They are having an advanced procedure. They are doing a minimum invasive procedure. All of these factors have played a role in deciding my choice of the center for which I will do my residency. In addition to that, and this was a personal thing, more of a scientific thing. I do with surgical specialties is different a little bit from medical specialties. In surgical specialties, you have to have a mentor. someone to guide you step by step in order to reach a level of excellent technical skills. And if you had that person, inshallah, hopefully will be an excellent surgeon and you will excel in your specialty. And I do think, fortunately, I do have that person in that center. That's why I choose this center. And at the end, this is just one article. I read it and I wanted to share it with you. Whatever center you choose for your training, either in here or abroad, there are things that makes you a good cardiac surgeon. And most of the time, it's dependent on you as a resident with a 70% rather than the center or the program you are joining. This article by Dr. Miller, which published in the Annal of Thoracic Surgery, 2004, was speaking about the qualities of the cardiac surgeon. He titled that article with the complete cardiothoracic surgeon. He mentioned a lot of certain characteristics. Out of these 13 qualities, I think having the quality of persistence is the most important one in cardiac surgery. So during your residency and even after that, you will face a lot of failure time. You will fail once, twice, and more. You will feel depressed and all of these. But if you have the quality of persistence, if you adapt yourself, if you have the faith, you will excel and you will reach your goal. Just have the faith in yourself and do the hard work, and hopefully, inshallah, you will reach to your goals. Thank you so much.
Thank you so much, Dr. Mohammed. Now we will move on to questions. If anyone has a question, please write it in the chat. So we have first a question. Why did you choose cardiac surgery specialty, not other surgical specialty? If Dr. Murtada can answer, please.
Sorry, what was the question?
Why did you choose cardiac surgery, not other surgical specialty?
Okay, so this question is hard to answer because choosing your specialty depends on your personality. It's like choosing what to do in your life. So for me, I chose cardiac surgery because I like the lifestyle of a cardiac surgeon. I don't like boring daily life. Cardiac surgery is full of drama, full of action, full of ups and downs, very challenging, risky. So if you are going to choose something like this, depends on your personality and what you like to do with your life. When I was younger, I think what drew me toward cardiac surgery was the heart itself as an organ. When I was in medical school, I just felt passionate toward this organ. But I was not committed to be a cardiac surgeon at that time, of course. Later, when I did my internship, I was fortunate to have cardiac surgery as my first rotation in my general surgery rotation as an intern. And I just fell in love with that beating organ when I saw it. And then I decided to spend 2 months in my internship in cardiac surgery, just to make sure that I really want to do this. I remember the cardiac surgeons I worked with when I was an intern trying to discourage me from pursuing this specialty because of all the difficulties that comes with it and the not as good income as in other specialties. So I decided to try interventional cardiology. So I also took a 2-month elective in cardiology, and I spent most of it in the cath lab. And I did not like the lifestyle of an interventionist cardiologist. Although they save a lot of patients and they do a great job and they make a lot of money. But for me, I like the life inside the operating room in front of a beating heart. So that's why I chose this specialty.
Okay, thank you, Dr. Murtada. The next question is, what is the perfect CV in order to get accepted in cardiac surgery? If Dr. Ayat can answer, please.
What is the?
What is the perfect CV in order to get accepted in cardiac surgery?
Actually, I can say exposure. Exposure, attending many ORs, being with many consultants, different centers. I work in different centers, so many consultants knows what is my personality, you know. So research, exposure, working as much as you can in the specialty that you want, and of course attending different courses.
Okay, thank you, Dr. Ayat.
May I add one point?
Yes.
About the CV? I do think that the CV is representing you. So the perfect you is the perfect thing. Do not just add things to your CV that's not representing you, and just it's a matter of how you are presenting yourself in your CV. As Dr. Ayat mentioned, having a good exposure, working a lot in the surface that you are in is a good thing, but it's not all about the cardiac surgery surface and the clinical exposure you have. There are a lot of other things that represent you as a personality that can be presented in a CV in a way. So just present yourself the way you see yourself. And if you are a good candidate for cardiac surgery, then it will show, definitely.
Thank you, Dr. Mohammed. Now, if Dr. Abdul can answer this question, which says, do you get the opportunity to work on research projects?
Yes, for now I'm working on 2 projects. One with my colleague and my friend Dr. Anwar Al-Halebi, she's in R3, and one for my own self. Yes, and yeah. As I mentioned before, the support from Dr. Qudeh, who is the head of the research committee in the center, and Dr. Abdul Al-Ataibi, they are supporting the resident, and they're supporting me and encouraging me to have the research. So yeah, I'm having good opportunity on projects I'm working on nowadays. So yeah, the moment you're starting to decide or to work in a project, you have to look on a center where the support is to the maximum. I know when you're not finding the support for doing a project for your own self, ما أدري أنا ما أعتقد إنه راح يكون في ذاك الحماس. لكن you have to find someone who's pushing you and asking you. Both of them, they are doing every 2 weeks a meeting about research and how you're doing on the research and what is the processing on the research. So yeah, alhamdulillah. So yeah, I'm working on it nowadays.
Okay, thank you, Dr. Mohammed. We have received questions that said, what are the frequently encountered mistakes during the interview? If any one of the residents can answer, please.
What are the mistakes?
Yeah, what are the frequently encountered mistakes during the interview?
Sometimes they will ask you about something that you don't know. So say simply, I don't know. If you don't know really, say I don't know. This is the first thing. Second thing, that just knowing the questions and their answers before going to interview, just to answer the questions. Somebody, I know they got prepared for the interview and they just vomit the answers. By this way, they will not know your personality. So as one of the doctors said, that's let them know your personality. Yes, you have to read. Can you mute your mic, Abdurrahman? Thank you. You have to prepare yourself for the interview, but don't make it like questions and answers. You know, this is what I noticed from many of the residents.
Okay. So we have another question that says, is there any cardiothoracic surgery program in Saudi Arabia?
No.
And Dr. Abdul answer yes.
There is no cardiothoracic surgery program in Saudi Arabia. There is only cardiac surgery program. And for thoracic surgery, it's a subspecialty after general surgery.
Okay. If Dr. Abdul can answer this question that says, what books do you recommend for interested students or interns? Okay, so or Dr. Muhammad, if you can answer this question.
At the level of the students or interns, I think if they start reading from one of the textbooks that having a chapters, surgical textbook that's having chapters for cardiac surgery, such as Schwartz and those textbooks, it will give them a good, concise idea about the cardiac surgery specialties. If they already made their choice and they know for sure they want cardiac surgery and they don't want any other specialties, then I would recommend them to start reading about the small cardiac surgery book that usually we read at our junior level. Things that give you an idea, just synopsis about the cardiac surgery and some pre and post-op issues related to that specialty. So you will enter the specialty and you already have a great and good idea and knowledge about it. But this, if you are 100% sure that you want this specialty and you will do whatever to join that pathway, then I would recommend you to start reading in the specific cardiac surgery book. Otherwise, if you are interested and you want to see and read more and expand your knowledge and you're still figuring out your choice, you may read through, just as I said, Piri Allah, Schwartz, this book. It will give you a good idea about the cardiac surgery and different procedure techniques and diagnosis. I think maybe other doctors may give you other opinions that might help as well.
I can add Oxford Handbook. You know, I used to have it in the hospital. I used to read between in the break, like between ORs or, for example, after the round. If I need an information, I will find it. Handbook, easy to handle and easy to read. It's really great one.
Exactly, excellent book. Exactly, thank you, Dr. Ayat.
I would add one thing. A few questions regarding books is related to the interview. In most interviews, they will not ask you technical questions or knowledge related to cardiac surgery. They want to know if you are really interested. So I would recommend, if you're inshallah decided to go for this and have an interview, to read about the history of cardiac surgery and know who are the figures in this specialty, who are the pioneers, the history of the procedures itself. This is what will get them to notice you. Yeah, that's the only thing that I want to add.
Okay, thank you all. So for the next question is, how competitive is the specialty? If any one of the residents can answer, please.
Okay, so maybe to enter the specialty, I don't know how competitive is it nowadays. 5 years ago, 6 years ago, it was really competitive. I don't know about it now. But the competition really starts after the acceptance, not to get to the program. Because of the environment itself, you have, as you've been hearing from everybody in the last 1 hour or so, you need to really prove yourself to your consultants, to your seniors. You need to shine in order to have a chance in this specialty. And the competition will be there with you even after you finish your training and you become a board certified cardiac surgeon. The chances in the work field are becoming less and less because of the more and more young cardiac surgeons graduating every year, and those who are coming from outside. So it is a really competitive specialty since the moment you decide to go into this specialty. From the interviews, throughout your training, to compete for chances, and then when you work as a independent cardiac surgeon in the field.
Just adding to what Dr. Matal have been saying. Yes, I think as I'm junior, just joining the program 2 years ago, I think it is still fairly competitive, not very highly competitive specialty, and it's not easy to go as well. So good GPA, fair or above average SMLE score usually will get you through to the at least to the interview, and then your CV will decide the most, I think.
If I can give an honest opinion about this, if you really want to go into cardiac surgery, you have to decide early and try to choose the center that you want to be in, and try to do as much elective as you can, 1 or 2 months during your internship in the center that you want to be accepted in. Yes, you can have the best GPA and all the other things in your CV, but in cardiac surgery, the culture is to know the person in person. They want to see you, they want to see your attitude, they want to see how really hardworking you are, they want to see how persistent you are, how do you deal with your colleague and your superiors. Do you really have hand skills that do you have the potential to have good hand skills later on? All of these things, it cannot be foreseen from your CV. They have to see you in person. So if you do all of the nice stuff in your CV, if you have research and GPA and everything, but the people in the center doesn't know you well, your chances is very slim to get in that center. So decide what center you need to go, and just go there and have 1 or 2 months elective there, prove yourself and apply there, and then they will accept you. This is the trick.
Okay, في سؤال هنا يقول if I was not accepted in the current match, what are the alternative plans? Dr.
Means
Ayat?
another specialty?
No, يعني I think if she mean that if she wants cardiac surgery, but she did it not accepted in this match. What
Actually, I've seen somebody that يعني went to general surgery, then cardiac surgery. This is what I've seen before. But you have to have plans, يعني plan A, plan B, not only this specialty. But if you are really has passion toward cardiac surgery, then you have to work in that. It means if I have not been accepted this year, I can work on my CV more and more. I can work with the يعني my weaknesses, like some residents, they have taken the whole year for exposure and attending OR and showing themselves, then they got accepted actually. Some of them, they went abroad.
I don't know. يعني what I know, and if even you're not accepted, you can practicing as a service or a GP in the same specialty for 6 months, and I believe the Saudi committee, they will add you some points. I don't know how much the point. If you're practicing the same specialty, you're trying to be involved in. Yeah, I advise you guys to have like 6 months, 6 months or a year at least practicing the same specialty. So yeah.
Agree, 100%.
I agree with Dr. Abdul Rahman. I think this is the best strategy if you really want to be accepted next year. Just apply as a service job for the time being until you have the next match.
If I might add to regarding this point, I do agree partially with that point. It is one way to go, and for sure it will add to your point in the CV being practicing, as well as more consultant will know you. A period of 6 months is a good time for them to know you, and to have for them to know you and for you to get a good exposure. But there is one thing you have to keep it in mind. Each year, the average score for the SMLE is getting higher. More residents will do much more effort, and they will be prepared much more as well. So one way also to go, I don't think it's a totally wrong, if you joined a surgical specialty program, and then you can change your program, for example, from general surgery to cardiac surgery. It's not easy. It's not guaranteed, but this is one way. At least you guarantee you are joining a program, and you are not missing the chance of joining a program, and years will be lost. In addition to that, there is a pathway in our Saudi program for cardiac surgery that after finishing the 4th year of general surgery, you may go through cardiac surgery from the senior level. Still present, this pathway is still present, and you can go through it. You will need to have some contact with the RTVs and these things, but it's possible. I don't know. It's one way also to go for it.
Okay. So Zahra asked, how many years does the residency program take?
7. And it might be 8 if you didn't meet the criteria.
Okay. Latifa Al-Qahtani asked, could you please specify which courses we need to attend? Yani, to get accepted or to improve the CV to get accepted in cardiac surgery?
See, just, yes, Dr. Murtaba, yes.
For me, I try to get all the courses related to the heart before I apply to cardiac surgery. I remember I had of course, the BLS, the ACLS. I took the ATLS, that Advanced Trauma course. I took the BOS, Basic Operative Surgical Skill course. I also took ICU course, Fundamental FCC, something Fundamental Intensive. I don't remember, it's like 7 years ago. So it's an ICU course as well. So the name of the courses will show your focus. So try to get courses related to cardiology and surgery and ICU care, because this is what you will need later on. And also I took an ECG course, an advanced ECG course, something like this. So try to look for courses related to cardiology, surgery, and intensive care.
Dana asked, how do you see the future of cardiac surgery?
Actually, I heard the word of cardiac surgery is dying specialty from many of the residents and students, especially if they are from cardiology, you know. But what I see that we are toward, if I'm not mistaken, Dr. Murtala can correct me, we are toward the minimal invasive. Yes, it's still there in the future, but we are toward minimal invasive. So we have to cope with the future things, but it's still there, if I'm not mistaken, Dr. Murtala.
Well, I wouldn't say cardiac surgery is a dying specialty. I would say it's a changing specialty. Because of all the changes in technology now, there is more and more interventional therapies for cardiac diseases. Now the trend is toward less invasive therapies. In order to survive in the future, cardiac surgeons now are getting more involved in interventional skills. For example, in the minimally invasive fellowships, all of them, they offer interventional skills training, like for TAVI and other skills. I think in the future, cardiac surgery will still be there. There will still be a great need for cardiac surgeons in the whole kingdom, but it will be less and less in the big cities, like in Riyadh, maybe in Jeddah, because from what I observed, there is a lot of cardiac surgeons there, and they are focused on those two cities. However, Saudi Arabia is a very big country with a very large population, which is expanding year after year, and the average age now is in the 30s. So those age group in the next decades will also get married and have kids, and the population will go larger and larger. So you will have more cardiovascular diseases with less cardiac surgeons with time, but they will need to be distributed all over the kingdom. So if you are thinking about cardiac surgery, try to not to fixate yourself into working in one of the big cities. You might have a chance. Yes, it will be very competitive to work in Riyadh or Jeddah, for example. But if you are an open-minded person to work anywhere else, you will for sure, inshallah, have a good chance. Yeah, that's it. This is for adult cardiac surgery. For congenital cardiac surgery, the need is very high for congenital cardiac surgeons, because nobody wants to do that. Actually, almost everybody I know, when they are young, they want to do congenital cardiac surgery, but then after they spend 7 years and then they graduate and they find their colleagues already building their lives and they are still in the beginning of the road, they hesitate to go through 3 or 4 or 5 more years in order to subspecialize in congenital cardiac surgery. And after all of those years, there is no good compensation for that subspecialty. So, however, if you really like the subspecialty of congenital cardiac surgery, I think that the need is great, and there will still be need for the few decades to come.
I agree with you, Dr. Murtada. So please, guys, don't listen to them when they say cardiac surgery is a dying specialty. I heard this word like since I was a student in the medical school.
We have a question from Hassan. Says, is cardiac surgery busy specialty with extreme demands over the social life?
Yes, it is, but it deserves. You can manage.
Yes, actually, after a few years, all of your friends and your personal life will be within the specialty itself. I don't think, I don't know a cardiac surgeon, a successful cardiac surgeon who have a decent private life outside the specialty, because you basically don't have time for anything else.
Ahmed Khalid wrote a question, says, how can you get my CV stronger?
I think we have answered this, huh?
Yes, we have already answered, yes.
Yeah.
Oh, okay, Dana also wrote a question. Do you think we will get to the point where all cardiac surgeries can be done by interventional radiology?
No, at all. We still need cardiac surgery, especially in pediatric, as Dr. Murtada mentioned.
Okay. Next question says, are there certain criteria in King Faisal Specialist Hospital required for applications for the elective and internship?
Yeah, they have their own criteria. You have to get the life support courses. You have to you have to have a good GPA. This is what I remember. And then you submit your requirements and CV. But it's there, I think, on the website. It's not that much. It's okay.
Okay. The last question, I think, says, is it easy to get 6-month service for a desired specialty?
What was the question again?
Is it easy to get 6-month service for a desired specialty?
Sorry, I didn't get the question. Is it easy to?
Is it easy to get 6-month service for a desired specialty?
I'm not sure. This depends on many factors.
If I may, Dr. Murtada, the question is a bit general. They did not specify the desired specialty. If he is meaning by his question the cardiac surgery specialty, I don't think there is a lot of centers that can provide a surface job in a cardiac surgery. I'm not sure about Riyadh region, but at least for here, you won't get a surface job. Less likely you will have the chance to have a surface job in cardiac surgery, but you might go there and work like it's like an I don't know what I can call it. Is it a postgraduate elective or postgrad training? But you won't be sponsored. There will be no salary for you, and you will just work there just to learn and improve your skills and knowledge. I know some guys who had the chance to work in a cardiac surgery as a surface job. but it was in regions far away from the big central cities. One of them, I think he was in Tabuk. It was a small cardiac center. They don't work pretty much cases, just a small number of cases once a week or sometimes none over the week. But at least he had a cardiac surgery service. In the big cities, these big centers, usually they don't provide, up to my knowledge, they don't provide a service job. But you can go and work as an elective, something similar to an elective, but without salary and without all the job benefits.
There is one resident with us who was working as a service job in King Khalid University Hospital, and after I think after the year after he was accepted, and he is now a resident with us. And there was also one or two, one other resident who was. He had a scholarship from his university, and he didn't have an acceptance, but he worked as a service job paid by his university for 1 year in King Abdullah Medical City. So there is some chances here and there, but and it's not
Dr. Murtada, does the hospital provide him with the salary, or he has an acceptance from a university? He's working as a staff at the faculty. And
I think he has a demonstrator.
Yeah, exactly. This is the way. If you are working at somewhere else, they can send you to do your surface work. But hospitals, I'm not sure about Riyadh region, but I'm pretty sure here in the Western region, hospitals will not provide you with the salary. If you are a faculty staff or something, or you are accepted from a center for scholarship, yes, you can work as a surface. It's more like an elective or surface whatsoever.
No, what I know, one of the residents who got accepted, when he applied for cardiac surgery first year, he did not. So he applied in Saudi Arabia for a job. He asked for a position of GP, and he got accepted, and he worked for 1 year, and then he got accepted in the residency. So you guys, if you go and ask for a position, you may be finding here and there as a GP cardiac surgery. But nowadays, I don't think so that the centers is providing GP cardiac surgery. But you can find like another position for, like, for example, the cardiology position or radiology position, and you can like ask them if you join the cardiac surgery. So yeah, for me, you can find a position. ممكن تحصلون إذا سألتوا عن a position. And yes, if you're practicing 1 year prior to your residency, your chances to be accepted is very high.
Okay, thank you. راح نختم بهذا الكويشن اللي هو can you put your emails if we have further inquiries about the specialty. Dr. Ayat,
sure.
Muhammad and Rahman.
Yes, sure.
Yeah, sure. Yeah, no problem. I'm more active in the Twitter, so you can find me there. I think I've liked the tweets from you guys, so you can find my account there.
Okay.
And you all welcome to ask.
Regarding my contact, I think Dr. Adha already have my contacts. She can provide whomever want to contact me either by WhatsApp or email. I'm glad to answer your question if I'm able to.
Okay, at the end, we thank you all, and we hope that you got the benefit from attending our first IAU virtual residency program fair for cardiac surgery. And we wish you all have a bright future that is full of success. We also thank our great speakers for your time in assisting others in making this important career decision. Thank you.
Thank you for you guys. Wish you all the best.
Thank you so much, and I'm really glad to be part of your initiative. Thank you for inviting me. See you.
Thank you, everybody. Good luck. I wish you all the best in your careers. And again, you can contact us anytime if you need anything. Thank you.
Thank you, and I'm glad to join and know all you guys. And yeah, as I said, you're all welcome to ask anytime.